Okay. Let's make sure it says we're live. Hey, yeah, we're live. Cool. All right. How is everybody doing today? So this was such a popular seminar. I'm so glad I finally broke down and decided to do it. Well, let me back up. I'm Kate Titus from Loyal Companion. This is my place. So welcome to my home. I'm glad everybody can be here. I see a lot of familiar faces, some that I don't recognize. So welcome to everyone. We are going to be talking about canine massage today. My demo dog, Helen, will be in a couple of minutes once we get down into the down and dirty of it. She is my almost 16-year-old boxer mix. So one thing you're going to notice when she walks in the room is that she's very thin. She's lost quite a bit of muscle mass, but she is hanging in there and staying strong. And I'm going to support her as long as she wants to stay with us. So she also has what's called canine cognitive dysfunction. So she looks a little lost. That's part of what that is. But the irony is that 5 years ago, I would not have been able to have her be my demo dog because she wasn't comfortable being around big groups of people. She's a little nervous. She's very much a stay-at-home girl. She either wants to be at home in my office or up on the mountain. So, so that is one of the benefits of the CCD, is that I'm able to bring her in and have her be part of what we do. So, yeah, so that is Helen. So I've told you about my dog. Now I want you to think about your own dog right now. So how old is your dog? Do they have any mobility challenges? What kind of situations have they been through? Have they had a CCL tear? Have they had an amputation? Maybe they have some back issues. Maybe they've got an abnormality in a limb. What is that? And we're going to think about those things as you start to apply some of the massage techniques that we're going to talk about. We're going to talk about later. And as you consider all of those issues, you're also going to think about how your dog compensates for those. So how many dogs do we have in here that had a CCL tear? Okay, that's one. That's you. Two. Yep. Yeah, so we have quite a few. We also have some that have had some back issues, right? Yep. Arthritis is another big one. All of the popular, the common aging diseases. Osteoarthritis is a big one. They're not moving quite as much, things like that. So you're going to be thinking about how they've changed in the way they move when we start to touch with intention, right? And that's what massage is all about. It's not just petting. It's nice. I pet my dog all the time, but I also touch her with intention as I'm feeling for stress, or I'm feeling for discomfort in her muscles, or discomfort in her back. Like, say, I know that she has it in her hips, and I also know she's got it in her shoulders because she's shifting her weight forward. So I'm looking for those differences in how your dog is moving. And those are going to be important as we talk about these things. Now, one of the other things that I want to be very clear about is that massage is what's considered a cooperative modality. That means that it doesn't take the place of veterinary medicine. It's there for you to be helpful, because you know what happens when you're massaging your dog? You find lumps, you find tension, you find things that are not what they had been before. So that's part of why the intention is in there, and it's not just petting, okay? Really, our goal with massage is to have a dog that is comfortable, that's aware, and that you can support, right? So we're looking to provide those three elements: comfort, awareness, connection with you. Let's not forget about the human-animal bond, and support for them, okay? Now, one of my favorite things that I've realized over 17 years of massaging dogs is that you start to think about your hands differently. So if you think about 5 senses, hands are usually related to what? Touch, right? Well, guess what? You can actually hear with them and you can see with them. Because as you're working on your dog, you're going to have a natural inclination to touch, to shut your eyes. You want to close out all of the other stimulus that's coming in so that you can concentrate on what's coming in under your fingers. And as you do that, a lot of times an image will come up in your head of what you're feeling. So like, for example, anybody a vegetarian in the room? Okay, I'll be careful to make my references as gentle as I can. So when I'm working on a big muscle, and if I close my eyes, let's say it's a tricep, okay? I'm working on this muscle or thigh. When I feel it, the vision I get in my head is boneless, skinless, stricken vest. That's what it should feel like. So that's the vision that I'm getting. So if you're quiet and calm and listen to what your dog's body is saying, you're going to get that. And that's where the connection and the information comes from. Okay. All right. Any questions on that? Yeah, I'm going to babble a lot. So if you have questions, my joke that some don't think it's funny that I'm a youngest daughter. I'm a youngest child. So I am so used to being interrupted. So if you have a question, just pop your hand up. I'm happy to answer that. Same thing for our folks that are listening online. If you have a question, pop it in the chat box. And as soon as Aubrey gets everybody checked in, we'll get to answering those. Okay, so why massage? What are the benefits of doing it? Why would you want to do it? Well, there are some physiological benefits that you're going to be gaining from that, and your dog is going to be gaining for that. Two big ones: improving blood flow, so we're going to increase circulation, and we're going to move lymph. Anybody know what lymph is? Tell me what lymph is. Yeah.
Lymphatic system helps drainage. It runs along arteries and veins.
Mm-hmm. It's a flusher, right? Yeah. So absolutely right. It runs alongside those veins and arteries. The big difference between the circulatory system and the lymph system is missing one big thing. It's missing a pump. That's right. So the way the lymphatic fluid moves through the body is through muscle movement. So if you have a dog who isn't moving much, they're going to feel sluggish for a lot of reasons. And one of those reasons is that the lymphatic system is not being as effective as it could. So you can think about the lymph system and how the lymph works as the trash collectors of the body. These guys go out, they eat up all the cellular waste from all of the cells that are doing the hard work in the body. They pick up all the waste and they chug back to the lymph node. They drop it off. It gets cleaned up. They go back out and they get more. But they can't go back out and come back in unless we got muscle movement. So that's another big reason why you want to do that. It really keeps your dog healthier and frankly more flexible because they're moving more. We're engaging those muscles a whole lot more. Now, one of the other big things that I see when you've got hands-on is that I notice asymmetry. So asymmetry is going to be one side is different from the other. They're asymmetrical. So I see that a lot in working on hamstrings or quads. Maybe it's the triceps. You'll start to feel they're not the same size. So that's another big piece of information that you're going to want to share with your veterinarian. You might find heat as well. It's maybe some swelling, running your hands along your body and paying attention to why you're doing it is information. That is data. You are data gathering to be able to share that with your veterinarian. But let's not overlook the emotional side and the emotional benefits that your dog, and frankly you, are also going to be receiving from doing the massage. So it's calming, it's relaxing, they feel safe. Even Timmy's eyes are starting to close a little bit after he got scared. So there's you should expect that was a yawn, right? So you should expect your dog to yawn while you're doing massage. That is a release, okay? That's something that you're looking for. And we're going to talk a little bit more about what to look for while you're doing it. But my two favorite groups, I guess I shouldn't have said that out loud, but my two favorite groups of dogs are mobility challenge dogs and seniors. Those are the ones that, frankly, I live for. Puppies are great, but I'm not one that loves puppy breath. So I'd much rather have rotty teeth, old dog breath than puppy breath. For those guys, for those seniors and those mobility challenge kids, we want to be able to match or find where they're having trouble in their everyday life. right? So are they having trouble going up and down the stairs? Are they having trouble getting up and down off the floor? Massage is going to help for that a lot. Being able to walk more comfortably. How many of you are walking your dogs, taking them out for a walk? Good, excellent. And the other piece that we don't want to forget about is confidence. Because what happens when your senior dog or your dog with a mobility challenge all of a sudden hurts when they do something? They don't want to do it again, right? Fear and pain are very good teachers. They're going to resist doing that. So we want to build that confidence up so they feel like they can do that again. Okay. All right. There are times when you don't want a massage, believe it or not. There are. And there are very specific situations where you shouldn't be doing it. One, for a physiological reason, or two, it could be a mental or emotional reason where your dog's like, yeah, no, I don't want you touching me. That's all great. You want to do that, but not right now. So let's talk about no-go situations. That's going to be things like open wounds. You're going to stay away from that. Recent fractures or surgery sites. There are some situations where you want scar tissue to lay down after you have an open wound. You need to not be messing around with that so that the fibers can basically lay down and create that closure. If your dog has a fever or any signs of infection. So knowing that you're increasing circulation, that's not really something you're going to want to do, is increase the movement of whatever infection is there. Certain types of cancer, you definitely do not want to be doing massage. Again, you're increasing circulation, so you don't want to be moving that cancer from into different parts of the body. Now, I will say, caveat for that one, if you are choosing palliative care and hospice care, massage all you want. But understand that the impact of what you're doing is helping to move certain types of cancers throughout the body. But if we're looking for quality of life and you're not treating, great, massage all you want. I don't know about you guys, but I don't like to have a massage within 30 minutes of when I've eaten. So I'm willing that your dog doesn't either. So give them some space. They've got a full belly. Let them process that. And you really only want to do it about once every 24 hours. Okay, so you don't need to overstimulate the circulation or overstimulate those muscles, okay? Always, massage should be collaborative and it should be consent-based. That means your dog is going to be part of the process and they also get to say when, where, and how much. Anybody seen Pretty Woman? Kit DeLuca. I say who, I say where, I say how much. Guess what? Your dog gets to do the same thing, okay? They get to decide. Okay. Now, I want you to think about your own dog and how might they tell you that they're uncomfortable or they don't want you to do it. What do they do? Okay. They growl, snap, what else? Move away. Okay, what else? When they don't want you to do it. When they don't. So opposite of that. So that would be tensing. Okay. So good answer. What else? Perhaps. So when you're looking at the yawn, you're also looking at other elements of the face. So a yawn with the ears back and the eyes kind of tight, that's a stress yawn. If they're soft, eyes are soft, that's a release. So you start to recognize those in your own dog. But that's absolutely right. Hold on. That's another common one. Yeah. Correct. That is another good one. Panting. What else? Yep. How about if they're laying down and you're massaging something back here? What might they do? Turn their head. Hey, what are you doing back there? Or they'll turn around. I've had some dogs turn around and just put their head on top of my hand. Like, I would really gently like to tell you to stop that right now. I don't want to have to get to the growl or the snap. I don't want to have to get there. There are so many subtle movements that you're going to be seeing when you're massaging your dog. So paying attention to those are important. So that leads me to say, if you're going to do a massage on your dog, don't be talking on the phone. Don't be watching TV. Don't be reading a book. This is the time when you get to focus and be with your dog. So stay focused and stay present with your dog as long as you can. Yes.
Initially, after the rescue with her, she was sensitive about her body, curious. She just very gently put her teeth around my hand.
Yep.
Very gently.
Just kind of a, this is what I could do, but I'm not going to. Right. So, and that's not uncommon with rescues that are new. Sorry, buddy. You snoring over there? That's not uncommon. That's, that's a, hey, I need to set some boundaries. And that's very healthy. And it's definitely something you don't want to discourage at all. Okay. Now, what might it look like if your dogs like it? What's it going to look like? They relax, right? Okay. What else? Lean into it. Excellent. What else? Fall asleep. Yep. Anything else? What about their breathing? Slow down, maybe get a little deeper, resting. Maybe they snore like Charlie over there. Yawning. But this yawn is going to look softer. It's going to look more like your yawn that you just had, right? So nice and soft. The ears are soft. To me, ears and eyes are a dead giveaway of what your dog's feeling. So if the ears are kind of flopped back and they're kind of pulled, they're a little nervous. If they're just kind of soft and hanging down, that was a nice gentle yawn right there. So it's just kind of, it's one of those. It's nice and soft. That's what we're looking for. But you know your dog best. So you know how they show you yes or no. Okay. 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 Little story. How many of you have been able to go to the bathroom by yourself with your current dog in the house? Okay. Yeah, I could shut the door. Yeah. I haven't gone to the bathroom by myself in 20 years. But what I often find, I know, I should have a little bit of class, but it's such an easy way to explain this. You're sitting there, you don't have anything else to focus on. So usually I'll have it, Helen specifically, she would come up and either give me her head and neck, or she would come and spin around and lean into me and give me a hip, or sometimes she would just kind of back in and I've had access to her whole back. That was always a good indicator to me of what she needed. Any of your dogs do that?
Yes.
Yeah. Yeah. You got nothing else to do. Put that phone down. So that, I think Kate here has given us a pretty good show too. She's like, right here, I want to be close to you and you can rub my back if you want and my neck. I don't want you touching my legs. She's kind of, even though her legs are up against her body, she's not asking for that. That's not where she's asking for. She's asking for neck and upper back. And mom is obliging, as it should be. But yeah, that is always a big one for me, is recognizing what they're offering. Because you may think, okay, I want to work on XYZ. Well, guess what? You don't just get to go and do that. You have to work through what they want first. You have to build that trust. You have to build that bond and go from there. Okay. Could you grab Helen for me, please? Thank you. We're going to bring Helen. Let's bring her in through the side door here, if you would, please. All right. So we're going to bring Helen in. And I'm going to show you, we're going to start with some hands-on work. So if you need to shuffle around or get in a place where you can work on your dog, now is the time to do that. It's nice to see everybody calm and just kind of relaxed. Dogs and people. That's always nice. Okay, here comes my girl. And then we'll have Andy in case we need a backup. Okay. All right. Let's see. So while we're waiting on Helen, let's talk about the 3 big keys when you're massaging your dog, things you need to pay attention to. They're going to be pressure, motion, and speed. Okay, pressure, motion, and speed. So let's talk about pressure. You want to use the pads of your fingers. No points, no tips. That's too hard, it's too much, and you don't feel as much. Okay. Hey, sweet girl. That's my girl. Hi. Hi, babe. Oh, I know you're the center of attention, huh? Yeah. All right, come here. You ready? Shh. It's okay. There we go, sweet girl. Okay, stay right here. Okay, right in here. Okay, good. Okay, so what I'd like you to do is I'd like you to take your hand and I'd like you to take your thumb and your forefinger and I'd like you to turn your hand over so you can see your thumbnail. Now I want you to gently push your fingers together and you'll see that your fingernail starts to blanch, okay? Starts to turn white. I want you to keep your fingers together and I want you to gently release the pressure until the blood comes back into your nail. You see that? That's the amount of pressure you're going to use. That is about 2 to 3 pounds of pressure. That's all you need. That's it. We're not fighting through a lot of human fat. We're not fighting through a lot of human muscle. You're okay. That's all you need. 2 to 3 pounds of pressure. Yes.
Just as you release.
Just as you release. So if you pinch it together, yes. Yes. So the question was, where is the amount of pressure? And it's really, as you pinch your fingers together, once the blood gets back into your nail, it starts to not be white, it starts to turn red or pink. That's the amount of pressure. If you have a food scale at home, this is an easy one. Go and put your hand on it and press until you get about 2 pounds of pressure, somewhere between 2 to 3, and that's all you need. Okay. So as I'm massaging Helen here, are we good on screen there? Okay. So as I'm massaging Helen, I don't have to push much. Yes, she is thin, but I don't have to push much to get through. Even if your dog is much heavier, you still don't have to push very hard. It's really just 2 to 3 pounds of pressure. That's all it takes. Okay. Nice and gentle. Now, when we talk about motion, I like to move in circles, especially across the epaxial group. So this is the group along the paraspinals, basically, the ones that run along the spinal cord. There we go. Good girl. Okay, there we go. So here, I like to go with the coat, circular, all the way down, okay? Now, I can also do that on bigger muscles. Nice circle. That allows me to feel different things in a similar area, okay? So that's your motion. Last thing, speed. So as you might imagine, invigorating, calming. Speed invigorates, slow calms. The faster you move, the faster you are asking her muscles to respond. And if you're trying to do a calming massage, that's not what you want to do. You want to go nice and slow. So we've got pressure, 2 to 3 pounds. We've got motion, and we've got speed. Okay, those are going to be the basics. Yes. Okay. So the question is it better to massage standing up or lying down? I prefer lying down. Helen does not prefer to lie down. If your dog prefers to stand up, and you know this is all about Helen, still good on image? Okay. So you do what feels good to them. You'll have some dogs where lying down feels very vulnerable. And that's the other thing. You don't want to do this in the living room when you've got, 4 kids running around playing, Robin Hood or whatever in the front. You want a nice, quiet, dim space. Okay. You doing okay? So yeah, lying down, standing up, it's up to you. So the other thing is I just found a spot on her body. So we can take a peek. Just a little skin tag. Okay. All right. So we've got those 3 important elements. Now, let's talk a little bit about different types of strokes. Let's see what we got here. Okay. So, first one we're going to talk about is super easy. There we go. Over here. First one is called effleurage. So, has anybody here ever had a massage? Okay. So, you know, at the beginning where the massage therapist just kind of runs their hands down your back, that's an effleurage. So, we're accomplishing quite a few things with that. One, you're feeling as you're running your hand down the dog's body, feeling for a couple of things. One, I'm feeling for changes in coat texture. That can be a big giveaway that there might be something going on under that change. Could be dermatological, could be skin-based. It could be something underneath that's going on that's changing the hair pattern of the hair coat. So I'm feeling for changes in hair. I'm also feeling for hot spots. Are there warm patches anywhere that I'm running my hand? What do I feel? Warm to the touch. But the next one is what? So she asked, is it warm to the touch or warm to them reacting to it? And my response is going to be, the next thing you're going to work toward is going to be, do they react when you get to a certain point? Like I know that Helen has severe hip dysplasia. So if I spend too much time around her hips, she's not going to be super excited about that. She's going to try to pull away from me. So let's back up a little bit. You're okay. You're okay. You go good? Okay. All right. So we've got effleurage. So this is going to be your opener and your closer when you're doing a routine. Okay. And it doesn't have to be perfectly set up, right? I usually like to make my hands as a W. So it's going to look, ooh, come here. Come here. Let's hop back up. Ready? Okay, can you hop back up? There we go. There you go, sweetheart. Oh, my bad. Okay, there. That's better. So I'm going to have my hands in a W or in an M. Okay, so we're going to go this way. So my thumbs run down the spine and down each side of the hip. Okay, just like that. And then I can feel lots. Yep, exactly. Just like that. So now I can cover the most amount of space. You're not going to spend a ton of time on that particular stroke, but it is the way you're going to start. You're always going to go from the head and end at the tail. There we go. Doing okay? All right. Any questions on the effleurage? Yes.
Just because I'm not familiar, the different textures of the skin, the fur.
Yeah.
Yep.
Mm-hmm.
You said you're going down
Yes.
the body before. You may feel like the fur is different.
The fur has a, yeah. So what, so you're asking about the fur texture as you're doing an effleurage. So the fur is going to, depending on one, if you have a short hair dog or a long hair dog, that's going to be one thing. Two, the type of fur that they have is going to be another thing. You want to sit? Let's sit. Oh, that's so good. Okay. So it can be like, my experience is that a lot of times the hair around the neck has a different texture or a different feel than that when you get down into the core of the body, and it may change again when you get to the legs. Now, what you may also have is a different feel or a different texture to that actual coat. So especially like if you get to the tail, if you can see how she's sitting now, she's actually sitting on her tail. So that would tell me that she probably has what I call old man tail. So the hair of her tail is going to be broken in a particular place because she's rubbed it off. So if she goes to turn or get up, she's going to twist and it's going to grind on that hair. So that's going to be one common place. Also, if they have any sort of skin issue, or they've got a lump, or they've got like she's got a little skin tag there, the coat's going to feel different there. It's just going to feel, it might feel greasier. It might feel drier. It might feel more broken. Like if I take off her collar right here, you can see that the hair around her neck, the coat here is a little broken from having a collar on. When I say broken, that's what I mean. Okay. Okay, let's put this back on just in case. Ooh, put it on upside down. Okay, did that answer your question? Okay, good. You're welcome. Okay, so that's what you're going to start and end with is an effleurage. So the next one we're going to work on is a kneading motion. Anybody made bread? Okay, anybody watch somebody on TV make bread? Yeah. Okay, so what you're looking for is very gentle. This is one that can get out of hand in a hurry, literally. This is one you want to use on big muscles. So like I wouldn't knead on the back. I'm going to knead on the big muscles of the chest, the triceps, the quads, or the hamstrings. So it's going to look like this. Okay, so not like this. Remember, no points. If you have fingernails, ladies, that's important that you don't get those nails in there. You want to keep it flat, just like that. Okay, and you're just going to knead across. I'll sometimes do it with pinky finger. I'll sometimes do it this way. So it looks like this. Because that feels like a knead to me. You're just kneading bread. You've got a big ball of soft, warm dough in your hand. You can even try it on your own shoulder. Thank you for that idea, Patty. You can feel it right here on your tricep. I have an ample tricep to try that on. Just this way, okay? We're moving skin, we're moving muscle, we're feeling that, okay? Oh, somebody doesn't like that. Raven's rolling over. He's like, yeah, get my belly while you're down there, okay? This is a good one to do to necks, okay? Nice and easy that way, right? Everybody's calming down. Everybody likes that one. Now, you saw Helen didn't just lose her balance there. As I was talking, I started to exert a little bit more force, and that was that's enough. So she kind of moved away from me. So I honor that, come back, nice and slow. In fact, I have completely open hands as I rub through here. Okay, yes? Yep. Yeah. Mm-hmm. It does. So the question was about younger dogs with anxiety, but no mobility challenges. Absolutely, yes. Anything that you can help, that you can do to help their nervous system quiet down is going to be good. And this is one of those that's going to help. And this is also important that we have the speed. If you do this fast, you're just going to rev them up. If you do it hard, you're going to rev them up. If you do it in quick circles, you're going to rev them up. So having those three things in place, doing it at the right speed, in the right motion, in the right place, they're going to calm down. Okay? It's going to be calming. Okay? All right. Oh, that feels good, doesn't it? Huh? Does that feel good? Okay, you can stand up if you want. Okay, stand up. There we go. Okay. All right. Now we're going to kind of riff on that one a little bit, and we're going to do a skin roll. Okay, so this one, it's really important that you have enough room and enough skin to do it. This is not one you're going to do down the back. This is one that you're really just kind of going to stay up in the neck area. So I got you. Sit down. There we go. Good girl. Okay, so what I'm going to do is I'm going to start up in here, and I'm just going to get, I'll show you on this way, just going to get a handful of skin, and I'm going to roll it between my fingers. So it's going to look like this. Okay. Be nice and gentle with this one. Okay, you can roll it between your fingers, forward and backward. Oh, good stretch, Timmy. Forward and back, nice and easy. So this one is we're pulling the skin off the fascia layer. So the whole body is basically covered in fascia. That's what keeps everything together. So everything isn't just swimming together. So sometimes the fascia can get bunched up. The skin can get stuck on it. So what we're doing is we're trying to lift that away to get rid of any adhesions or anything that could become an adhesion. So that becomes a freedom of movement stroke. That answer your question? Yeah. The question was, what does it do? That was the answer. Okay. All right. This also will help you determine, can be a good indicator of hydration, which is important here in Arizona. Helen needs to drink a little bit more water. You can see how it kind of gets tacky. It kind of gets stuck there. You want that to just slide right down. That was actually pretty good. You see how it just slides right down? You want that skin to be nice and loose along the skin. Oh, somebody's got to go potty. Okay.
That be true over the amputation site? To do that one?
The question is, should we do that one over an amputation site? That is a very, I think that's a very personalized to the dog question, because if there's not a lot of skin there, that's not going to be comfortable. 2, depends on how long it's been since the amputation. The dog is still trying to figure out, the neurologic system still thinks there's a leg there. So they're trying to reprogram that brain from a quadruped to a tripod. So I would do that very, very gently if I were going to do that. Personally, if I had an amputation site, I would stick with the circles, and you would still be able to feel the fascia moving across the muscle. You may feel more adhesions there, because after that amputation, there's a lot of scar tissue that forms in there to slow that down, right? To adhere that. So you will have adhesions in there. Okay. And that is sometimes why dogs are uncomfortable. Part of the reason why they're uncomfortable after amputations, because there are adhesions there. So when they move, it pulls and it hurts. Yes.
So that would be a case for a controller for pacemakers as well?
Controller for a pacemaker, I would say yes. So you would need to be cautious about that. You could go around the area and see what the response is. You could try it. She's like, no, I'm not having it, right? Okay, so I would stay away from it. But what I would also do is I would go, so the pacemaker is about here on her controllers in her neck. So what I would do is I would go diagonal from that and go down to the chest on the other side. And I would massage there, because that's where the pull is likely coming from. The other thing I would do is I would look and I would try to get an idea of what muscle it's attached to or where it's buried, because it's probably on top of it. And then I would work above and I would work below. Okay. Any other questions on that one? No? Okay. All right. Yes? Yes. Could it change the position of the microchip? Likely not. That should be, that's a sub-Q injection. It's unlikely that you're going to move it. They migrate. We have, I've heard people find a microchip like here, or I've found them down here. That's why when you go in and they check for the microchip, they should do that every year at your vet's office to make sure that it's there. That's why they wand the whole body, because sometimes they move. But that's not going to be a cause of it. The last one we're going to talk about is gentle tapping or some jostling. Now, if you've ever been at the vet and they're trying to do blood work or they're trying to look at something and you have a tech at one end of your dog's body doing this, that draws their attention away from what they're doing and brings it up here. So for senior dogs, I like to do just really gentle tapping on their skull. You don't want it to be irritating, but just a, hey, 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 where are we focused on? And you can do that at any part of their body. Okay. If you have a recent amputee, this is a good one to do near the amputation site. That helps the nervous system to regulate the nerve responses as the brain is trying to learn what is different about that space. Okay, so just gentle. You remember the as seen on TV thing where you had the thing that goes down your head? That's what you should be imagining, right? So just pop, 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 pop. It's good for awareness. You want to keep it simple, obviously. It's just a little stimulation, light and brief. And she just told me she was done. Did you guys see that? She just went, knock it off. Got it. That's enough stimulation for you? Okay. Okay. So let's go through a short at-home routine that you can do. Okay. So important elements here. You want to keep it short. You want to keep it positive, and you want to be realistic with what you think you're going to be able to accomplish. And most importantly, you want to follow your dog's lead. Okay. So you're going to start with 1 to 2 minutes of effleurage. Down. If she were lying down, this would be a little bit easier if I didn't worry about her falling off again. But I'm just feeling all the way down. Sometimes I'll get her tail. Sometimes I'll just run down the back of her leg. The other thing you're doing when you do the effleurage is the bladder meridian. If anybody in here done acupuncture, either had it done to yourself or to your dog. Okay, the bladder meridian on these guys runs down like this and down the back of each leg to the back of the paw. So that is that's one of the calming meridians. So if you're bringing that hand down this way, you're just bringing the body into a very quiet place. Oops. Okay. I won't touch her butt. She didn't want me anywhere near that. I will tell you that she has some overnight incontinence. So we have to put a diaper on her. So she does not like me to mess with her tail. She doesn't like it going on. So I'm recognizing that that doesn't bring up good feelings when I get too close. So I'm going to leave that alone. So I'm going to listen to that piece of advice she just gave me. Okay. So the next 2 or 3 minutes, you're going to spend on an area that the dog has presented to you. So if you lay down and you're running your hands, if the dog is lying down or even standing up, you run your hands down. Let's say that you got to a shoulder and they went, oh, stretched back. You're going to focus on that. So you're going to spend just a couple of minutes working on that. One common one you'll see is if you run your hand down the front of a dog's thigh, they'll sometimes go, oh, and that is a good stretch. So you can work on that one. Right? So find the spot that your dog is focused on. So this massage is intended to be only about 5 or 10 minutes long, depending on what your dog is open to. Okay? Short and sweet. Short and sweet. Helen likes to have her chest massaged, so I'm going to go in for her pecs. I'm going to give you one extra touch technique too. How many of you drink coffee? Okay, so if you buy beans and then, what is it called? Blitz them, blend them up, whatever. Grind, thank you. Sounds like one syllable. To me, I always want to put my hand in the beans and just pick them up, right? Even if you have dried regular beans at home, it's this motion, okay? This is a great one, this cupping motion for right in those pecs. It's this, okay? Just like that. Good girl. She seems to enjoy that. I can get a lot of like head hang and relax. I also know that if you can see her, she has a lot of forward weight shift, right? She is trying to get a lot of weight off these legs. That means these pecs are working overtime. Her shoulders and her triceps are working overtime. So I want to make sure that I get those and that she feels good about that. Okay. All right. So I found that spot, did that 2 or 3 minutes, and now I'm going to close her down. Okay. Yeah, I know we're almost done. Again, I got close to her back. I got close to her tail, and she's like, So that's fine. I'll honor you with that. That's a good girl. Okay. So now she's done. All right. Any questions on that? Any questions? Okay. So one of the big things that you're going to take away from massaging and working with your dog is learning to be aware through your touch. What are you feeling? What are you finding? One of the things that you're going to get in your thank you email today is going to be a massage chart. It's going to have a picture of a dog so you can mark down anything you see. Like, you probably can't see it from here, but Helen has a big black bump on the top of her head. I know I showed you one she has over here. You can use that as a kind of a body map or a body atlas if you want. Go through and mark all those bumps. But I'm also going to indicate what did she like, what didn't she like? Where do I have hot spots? Where do I have tension? What made her happy? What didn't make her happy? So you're all going to get a copy of that in your email after we're done. So that is a great way, and it's a great thing to share with your veterinarian. If you walk in and say, here's a map and I found a spot right here on my dog's leg, guess what? Your vet can now go within a few inches of where that spot was and be able to look at it quickly. Yes. There are toe and paw. So toes, you're really going to be looking at stretching and extending and flexing of the toes. So that, let me see if she'll let me do that. Hi, can I see your pawpaw? Yeah, oh, it's okay. So I'm going to be looking here. Same sort of, let's see, I'm trying to think of, this is going to be the circles. So metacarpals or metatarsals on the back. Nice small circles. You can also do a stretch or an extension by putting your finger under the pad and extending it out. There's a knuckle here that's underneath my thumb. Not sure if you can see that, but we're going to push that and glide it out. So those are called toe glides. That's one you can do. Another one you can do is you can massage between the digits in that webbing area. I highly recommend that for new dogs to your house that you haven't had to do any nail trims with yet. Getting them used to having their paws handled is a really great idea, and massage is a fantastic way to do that. If they're a little sensitive about that, then you can touch and treat. So massage that webbing, treat. Massage the webbing, treat. Let me tell you, your vet technicians and your veterinarians will love you for that, because they're the ones that have to put up with grumpy growlies when they're trying to trim your dog's nails. So keeping those comfortable is really, really helpful. Any other questions on that one? No? Okay. So when you think about when to massage, I personally love to do a massage right before everybody's going to bed. It calms me down. It brings my nervous system down from like up here. It calms the dog down. They're ready to just fall asleep in their bed. So I like that time. What I don't like is a time that is in the middle of the day or first thing in the morning when you actually need them to get up. We got to go for a walk. That's the start. Okay. Yes. Tail massage techniques. Yes. That is not something I can show you on Helen, but I can tell you. So if I run my hand down Helen's back till I get to the back end, would you let me do it? Huh? Would you let me do it? Okay. Would you let me do it? Okay. All right. So what I'm going to do right here, I'm going to have my hand here, right? So hand right above her tail. Can you stay here? And then I'm going to slowly go in a circle. I'm going to go 5 times in each direction. Okay. And then you can do a gentle tail traction. So I'm just go up, up, up. You see? I'm just going to pull and hold. Literally just that 3 pounds of pressure. Okay. Pull and hold, move down, pull and hold, pull and hold, pull and hold. Okay.
What about if your dog doesn't have a tail?
Then you probably don't have to worry about it. Just a little nubby, then you can massage the muscle. There are muscles on either side and on top. So you can massage all around those spaces. And if they'll let you, like Boston Terriers don't have much of a tail, Frenchies don't have much of a tail, Sometimes they're very sensitive. If you have a dog whose tail has been docked for breeding reasons, yes, you want to be really, really careful with that. That may not be something that they want. Depending on their age, it may be something that you need to do. But I would have that very much guided by your veterinarian, because that is, if you, let's be honest, the tail is literally part of the spine. So you want to be careful with that. There are nerves in the tail. So you want to be very cautious with that. The bundle of the nerves, that is the spinal cord, basically comes out, and Christy, correct me if I'm wrong, but it comes out of the protective casing that is the vertebrae right about in here. And it spreads out and it looks like a horse's tail. That's why it's called caudal equina. So horse's tail, that's what it's called in the back. Hold on one second. Yes.
Is doing that tail massage pleasurable for the dog, or is it something that is good for the spinal?
It can be both, but you really want to be careful with it. You want to go slow. Dogs they're not like cats. They do not like to have their tails played with in most cases. So what we're trying to avoid is, if you have a dog that has an up tail like Coco here, it's an up and over the back. A lot of Huskies have a tail like that. Border Collies will sometimes do that. We don't want them to be sore or have a lack of flexibility in that tail, but not every breed is meant to have a tail like that, right? So that would not be comfortable, this tail here, on Lily, on a Labrador, where that tail is coming down. But we also want it to have enough strength and flexibility to come up, flag, wave because they're happy, any of that. So it can be good, but you have to be careful with it. And if you have a dog who doesn't like their tail maybe coming up past level of their back, that's probably something you need to mention to your veterinarian. There is something called a tail jack that they do, that neurologists will often do, sometimes primary care will do. That can, if there's pain on that, that can be an indicator of a spinal issue or a nerve issue in the back. That's one of the things they do. It's called a tail jack. Okay. Yes.
If you had a dog with an underdeveloped toe, would the circle massage be good for that toe?
Yes, they certainly would be. If it's underdeveloped, you would really want to watch how the dog walks on that. It also depends on which toe it is.
It's the outside on the front paw.
Outside, so it's number 5, it's pinky, right? Okay, so if you think about a paw and how they use that paw, just like us, number 4, and I won't show you number 3, but these two are the weight-bearing toes. So as they walk, these are the two that really support the forward motion. These two are going to support the side to side. So I would be looking at, yes, it's fine to massage it, but if there is pain in that, that is probably something that will need some orthopedic attention. It may also require a padded boot. So part of the problem is if this is really short or underformed, then you're going to get some rotation in the paw. How many of you have back issues? Okay. And how many of those have started in your feet? Not uncommon. Problems start from the bottom and move up. So if that's causing an issue, that underformed toe is causing an issue, then we should probably look at some sort of either a boot or an orthotic to be able to distribute that weight more easily along that paw, and that will help with that'll help with the discomfort if there is discomfort in that paw. Okay, all right. Let's see. So just to kind of wrap up here, the other thing that we want to think about is to remember. I know. Shut up. I get it. Okay, so apparently we're done. Raven says we're done. All right, so remember you're feeling for heat and cool. Remember, cool is important to feel for as well, especially if you're in feet. tightness, muscle loss. We talked about asymmetry, lumps and bumps, tender spots, differences in the way the coat looks side to side. Keeping that simple body map can be really, really helpful. If you have a dog who's already had cancer, that is incredibly important, especially if you've had like mast cell tumors. Those little evil guys tend to pop up if you don't get them, you don't pay attention, they seem to come back. I think one of the things I want to stress here, we're going to let Helen go back to her office. Is the door closed? Okay. Good girl, baby. Thank you for your help. You're such a good girl. No, let's not go back that way, though. There you go, sweetheart. Out, out, out. Oops. Nope, nope, nope. You don't need to say hi. Go on. Out, out, out. There we go. Thank you. And I did brush her, believe it or not. Is you don't have to do everything perfectly. You just have to put your hands on your dog, and you have to be paying attention when you're doing it, and you have to put those hands on there with intention, just to feel what's going on. It can be, you'd be surprised what you find. You could even find a tick, right? So you could find a lot of things. You could find a scratch that you didn't know was there, had you not found, could have gotten infected. It's just information, and it's a way to really just stay with your dog and be present with your dog. Okay. All right. Any other questions? Yes. Cool. Yeah. So if you have especially cold toes or distal down at the bottom, digits, paws, anything like that, that's something to pay attention to too, because that can mean you're not getting the circulation down there that you need. And there could be a lot of reasons for that. So now, if they've just been outside and it's 50 degrees outside, that makes sense. But if it's markedly cool on one side and from the other, that's what you're looking for. You're looking for, it's that asymmetry again. It's not just in size, but it's in feel and heat as well. Okay. And that is, you can walk in, I can tell you every veterinarian on the planet, if you walk in and say, okay, here's what I found, here's where they are. And this is a list of the things that I found on the massages that I did over the last 3 weeks. They might kiss you, so be ready for that. And I'll be very frank that if they don't and they say, okay, great, thanks, it's time to get up and walk out. I love my veterinary crew. I love the practices that I work with. But that is a team, right? You are part of your veterinary care team for your dog. And if you don't feel like that, and if that's not the vibe you're getting, it's not the right practice for you. And we can, I'll help you find another one. But it needs to feel like it's a team. Okay. All right. Any other questions? Yes. Yes. This is recorded. So the link that you may have received will show the recording of this seminar. It is also on our YouTube page. If you go under the live link, just go down and look for Canine Massage, and it will be there. The other thing I want to announce is that we had such an overwhelming response to this. I am going to teach a class in May. I'm going to have a 4-week class. It's going to be hands-on. We are taking 6 dogs and 2 auditors. So that means people that came without a dog. That would be you guys. And we are going to go over we're going to go much deeper into the massage. We're going to go deeper into the muscles. And we're going to focus on massage for some specific diseases or conditions. So one of the ones we're going to work on is rear end weakness. We're also going to work on OA or osteoarthritis and senior dogs. And we'll also have at least one of the sessions will be on stretching. So we're going to kind of take this seminar to the next level in that 4-week class. You'll be able to sign up for that on our events page. We should have that up in the next couple of days. So if you'd like to learn more, we'd love to have you and your dog if you'd like. Yes, it is going to be Wednesday nights at 6. Okay. All right. Any other questions? I am. I am doing massage again. So if you'd like to bring Brady in or you'd like to bring anyone else in, I'm happy to get you scheduled for that. Yeah. Christy's asking about my use of a tuning fork. So if I know what a tuning fork looks like, okay. So when you hit the tuning fork, the end of the tuning fork, it makes a tone. They're often used for tuning instruments, right? But in our case, I can put I think the one I use is an amethyst tip, which is good for arthritis. I will actually put that on some of the major muscles of the body. I like to use it on backs. So I'll go down the side on those epaxial groups. And if I feel, as I'm running it across, if I feel something sticky, I'll stop right there. So that vibration actually helps to break up the adhesions within that fascial level. I love to use it. I have to admit that every time I hit it, I have to hold it to my own ear. It does really nice things for my nervous system. So 128, that's my number. I think that is a C. I'm not sure, but I think it is. So yeah, so it is actually moving tissue. And when you're holding your dog, like when I'm doing that, you can feel it in different parts of the dog's body. So if I were doing it let's say I'm doing it on a thigh, you're going to be able to feel it on the underside, and you may be able to feel it up into the hip. So it's a very cool tool that I love, and I've been using for about a year now. Thanks for asking about that. Yeah. Is that the one that's purple? Yes. Yeah. So it's an amethyst stone. And you can unscrew it and put different tips on it, but that's the one that has a much larger group of things that we can that it works on. There are different tips that work for different things. Yes. I took a course through Dr. Lori McCauley. She has a website called Optimal Pet Vitality. Great course. And she sells those on her site with the different styles of tips. Pretty easy course to go through, but pretty amazing when you use it. She's a pretty amazing woman. She was actually the inventor of the underwater treadmill. So she is a big deal in the canine rehab world. So if she says it, I'm like, okay. I don't often follow blindly, but I would probably follow her off a cliff. Yes.
It's not of sufficient general interest. Just tell me, I'll inform you later.
Yeah.
It turns out it has some motion discs higher up than we do. When we just touch him, most often there'll be that recoil.
Yep.
Which I assume is pain. I don't know.
Okay.
But I don't know whether that just means stay away or take
Okay.
a broader, more general, slower approach. Or,
Okay.
You know what I mean?
Yeah. 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 So so we're talking about Paco, who has some narrowing of disc space higher up in his spine, so probably close to his shoulder blades.
Yeah.
Yep. And some bone spurs. Okay, so he's had a lot of movement in his spine. The vertebrae, there's a disc in between each vertebrae, so they're getting closer, which means it's probably pushing the disc material up toward the cord, which could be causing some discomfort. What I think you're describing is, I believe it's called a paniculus response. So when you touch it, the skin goes, it like flutters. Does he turn around and look at you when that happens? No? Okay. So that's usually a tension point as well. So when I touch skin and I'm doing massage and I get it's like that type of movement in the skin, then one, I'm going to lighten my touch, and two, I'm going to come back to it and I'm going to try to smooth it out. I'm going to try to get that skin to relax and flow more easily on top of the fascia, but I'm also going to feel for any sort of trigger points and knots that are in that area. So if you have, anybody in here have nerve pain in your back, in your shoulders, whatever. Okay. So nerve pain is kind of like a shadow. It never goes away. You try to get away from it and it's like, it's always there. So sometimes that can be what's happening with Paco. I mean, I'd have to put my hands on him again to really get a good sense. But your goal in doing the massage from that is to get the muscles around that and the compensatory muscles. If he's been walking like this, then he's going to be really sore up in here, right? So on the other side of where that narrowing is, you're going to try to stretch that neck out and get it to relax, and also along the back and the sides.
And related question, if I could, when on a tail, sometimes I'll touch his tail and I'll feel a spot, like it could be a sticker stuck in there. It could be, I don't know what, he doesn't like it, he's not messing with it.
Yep.
Is that a situation again where you slow down your approach and you try to see what it is, or you respect the dog and
I respect the dog, mark it down, and take him to the vet and let them be the bad guy. Because remember, you want to maintain that relationship. And honestly, if by you digging around in it, are you making it worse, and are you making it harder for the doctor to be able to get a vision, get a look, and pay attention to it? You know what I mean?
just trying to see if it's a piece of something sticky that needs to come out, or if it's
Yeah.
a real thing.
Yeah. And that's another thing, especially with our longer coated dogs. It's foxtail season, by the way. So checking your dog for foxtails. But if it's there and you know it's something that needs to come out and they're getting fussy about it, just make a note of where it is and come back to it. Get it little bits at a time, or do what I do and just cut it out. All right. Any other questions?
Yes, what's the website to sign up for the massage?
AlohaCompanion.com. And then there'll be if you go to the events, which is in the horizontal nav, just click down, it'll take you down there. When that's open and ready, you can just click that and head on in. Okay. All right. Any questions? Is that it? Yeah, go ahead.
If like his head was crushed when he was a baby, so that even the light tapping, that's like.
Yep. You don't have to do it there. Mm-mm.
Leave his head alone.
Yeah. So the question was, we have a dog whose head was crushed when he was a little youngin', so he doesn't really appreciate the tapotement, the tapping on there. Don't do that. I would be willing to bet you could get some neurostimulation just by going on his neck. Like even as I do that to myself, I'm like, oh, what are you doing? Like it's like you wake up, and that's really all you're looking for. It's not going to be something you're going to do long term. That's like 15 seconds worth of stuff. Yes, last one. Tell them I'll give them $20 later, because yeah, that's the other thing I want to throw out there is that it depends on the type of valley fever and where it is. Is it disseminated, or is it still in the lungs? But yes, there are. I could add that to the list of what we're going to teach in the course to address that. The other thing I will say is that we are about a week to 10 days, maybe 2 weeks away from releasing 2 new courses on valley fever. One is what is it? It's a six chapter course. And the other one is how to use movement as medicine to help your dog through the treatment period and even after the treatment period of valley fever. Okay, so that is coming. So keep your eyes open for that one. Okay. All right, fantastic. I want to honor everybody's time. Sorry we ran a little late, but thank you so much for coming. I really appreciate it. All right, Dolly. Good job. All right, so we're going to try to get out of here in an orderly way so we don't have dogs chunking up against each other. Okay. We do have side doors if anyone wants to go out a side and not go through anything. You have a side door there, it just needs to be open. We'll let you head out with Charlie. We're going to try not to get too much of a bottleneck here. If you don't have a dog, you're allowed to leave whenever you'd like. I mean, you're all allowed to leave, but you know what I mean. You can go ahead and stop the recording. Okay. You're welcome. It was good to see you again.
Bring Brody back.
Yes.